the previous lectures.
Sorry, sir, we can't really hear you properly.
Which one is that, Dr. Savras?
I'm saying I couldn't hear you properly. I think you got cut. So I didn't hear the last bit.
What are the conditions that can lead to tachypnea?
So it could be panic attack.
Panic attack, excellent. So panic attack is a cause of respiratory alkalosis. What are the other ones?
Excessive vomiting.
Excessive vomiting. Excessive vomiting will cause metabolic acidosis and not respiratory alkalosis, because vomiting will lead to the loss of bicarbonate ions. So whenever there's the problem is due to bicarbonate ions, you will say it's a metabolic problem.
Obstructive lung diseases.
What about trauma?
Yeah. Pulmonary embolism.
Okay. Can you please write down in the chat segment? Yes, pulmonary embolism and panic attack, both of them can cause respiratory alkalosis. Give me a minute. Let me change the headphones. Then I guess this voice problem will be solved. Can everyone hear me now?
Yes.
Okay, I can hear you as well.
Yes, we can hear you.
There was a problem in my headphone. I have changed it. So your question was how PaO2, partial pressure of oxygen, is related to respiratory alkalosis. Remember that partial pressure of oxygen is, you can say, not related to respiratory alkalosis or acidosis. It can be low in both of them.
Right.
It has no relation with, like in asthma or COPD, we can have a low partial pressure of oxygen, but there will be respiratory acidosis in asthma or COPD due to CO2 retention. So
Right.
partial pressure of oxygen is not related to alkalosis, respiratory alkalosis. It is related to the underlying condition that is causing respiratory alkalosis.
Okay.
So we were discussing respiratory alkalosis and its causes, that tachypnea or hyperventilation can lead to respiratory alkalosis. And the causes of hyperventilation included pulmonary embolism, and the second one was panic attack. Both of them can lead to tachypnea and respiratory alkalosis. What is the single most differentiating point between these two? How you can differentiate between pulmonary embolism and panic attack on the basis of ABGs? Can somebody tell me?
In pulmonary embolism, pressure of oxygen will be low, but in panic attack, it will be normal.
That's right. Any other acid-base abnormality other than partial pressure of oxygen? So what will be the compensation in case of respiratory alkalosis?
Metabolic acidosis.
Yes, as panic attack is short-lived. Panic attack is about 15 to 20 minutes. So there will be no compensation in case of respiratory alkalosis due to panic attack. So bicarbonate ions will be normal in respiratory alkalosis. Oxygen will also be normal, and bicarbonate ion will also be normal in respiratory alkalosis that is caused by panic attack. While pulmonary embolism is not a short-term condition. So in pulmonary embolism, what will happen? Metabolic compensation will occur. That is, bicarbonate ion will be low in case of pulmonary embolism. So these are the 2 points on the basis of which we can differentiate between pulmonary embolism and panic attack. That is partial pressure of oxygen and bicarbonates. Both of them will be low in pulmonary embolism and normal in respiratory alkalosis due to panic attack. Is this point clear to everyone?
Yes, it is. Thank you.
So we have discussed the causes of respiratory alkalosis and respiratory acidosis as well. The important causes of respiratory acidosis is anything that lead to decreased ventilation or hypopnea. Decreased respiration will lead to CO2 retention and respiratory acidosis. 2 important causes are asthma and COPD. There are some other conditions that can lead to respiratory acidosis, such as in pleural effusion or empyema. If there is fluid in the pleural cavity, uh, respiration will be compromised. So they can also lead to respiratory acidosis. So anything that compromises the respiration, such as or causes airway obstruction, such as drugs that can lead to respiratory depression, benzodiazepines, organophosphates, conditions such as COPD and asthma, and pneumothorax, hemothorax, or pleural effusion or ascites, all of them interferes with the respiration, so they can lead to respiratory acidosis. While the causes of respiratory alkalosis, they include pulmonary embolism, panic attack. We have already discussed these two. And the third cause is salicylate or aspirin poisoning. Remember that aspirin poisoning causes respiratory alkalosis as well as metabolic acidosis. Aspirin poisoning can cause respiratory alkalosis because in the beginning, salicylate or salicylic acid, they stimulate the respiratory center, which can lead to hyperventilation and result in respiratory alkalosis. But in later stages of aspirin poisoning, what's happened is that aspirin is an acid. So the direct acidic effect of aspirin can cause metabolic acidosis as well. So in early phase of aspirin poisoning, respiratory alkalosis will occur. So panic attack, pulmonary embolism, and salicylate poisoning early in the course of poisoning will cause respiratory alkalosis. Well, respiratory acidosis, anything that decrease the respiration, such as drugs, benzodiazepines, organophosphates, COPD, asthma due to CO2 retention, pneumothorax, hemothorax, and ascites, all of them can lead to respiratory acidosis. Now remember that if a person is on ventilator, he can develop respiratory acidosis as well as respiratory alkalosis. If the rate of respiration through ventilator is high, respiratory alkalosis will occur. And if the rate of respiration is low, then respiratory acidosis will occur. So if a patient on ventilator, he developed respiratory acidosis, then it means we need to increase the ventilation so that CO2 can be washed out. And if a person on ventilator, due to rapid ventilation, if he has developed respiratory alkalosis, then I will decrease the ventilation rate so that excess washout of CO2 can be prevented. So the causes of respiratory acidosis and alkalosis, are they clear to everyone?
Yes.
Okay, now metabolic acidosis and metabolic alkalosis. What are the causes of metabolic acidosis and metabolic alkalosis? Metabolic acidosis can be caused by drugs such as metformin, aspirin. In the later stages of poisoning, iron, isoniazid, alcohol, digoxin, and paracetamol is a less common cause. So and the mnemonic for the drugs that causes metabolic acidosis is MAD, MAIIAD. And the condition that can cause metabolic acidosis, diarrhea can cause metabolic acidosis because of loss of bicarbonatines, renal failure, whatever the cause of renal failure, because excessive acid is excreted by the kidneys. So any problem with the kidneys will result in metabolic acidosis. And Addison disease also causes metabolic acidosis. So what is the mechanism of metabolic acidosis in Addison disease? Who will tell me the mechanism of metabolic acidosis in Addison disease? Recall from endocrinology chapter how Addison disease can lead to metabolic acidosis. So the mechanism of metabolic acidosis in Addison disease. What is Addison disease? Addison disease is adrenal insufficiency, less production of aldosterone and cortisol. So what is the action of aldosterone, or what is the function of aldosterone in the body? If you know the function of aldosterone in the body, you will know why Addison disease causes metabolic acidosis. So the function of aldosterone is,
Sodium retention.
yes, it reabsorb the sodium and excrete the, it absorbs the sodium and excrete two positive ions, that is potassium and hydrogen ion, in return to this absorption of sodium. So if there is no aldosterone in the body, that happens in the Addison disease, what will happen? Hydrogen ion will not be excreted. Potassium ion will not be excreted. So metabolic acidosis will occur. So the causes of metabolic acidosis that you need to remember are the drugs, diarrhea, and renal insufficiency, and Addison disease. Now metabolic alkalosis. Metabolic alkalosis, the important cause of metabolic alkalosis is vomiting, because in vomiting there is gastric acid is lost, so it will result in metabolic alkalosis. Hypokalemia and hypovolemia can also result in metabolic alkalosis, and secondary hypoparathyroidism can also result in metabolic alkalosis, because parathyroid hormone increases the excretion of hydrogen ion in the kidney, so it will result in metabolic alkalosis. ACE inhibitors, NSAIDs, and diuretics such as loop diuretic and thiazide diuretic, they can also result in metabolic alkalosis. So this was all about the causes of metabolic alkalosis. Metabolic acidosis, respiratory acidosis, and respiratory alkalosis. An example is given: a 54-year-old man had a cardiac arrest and was successfully resuscitated following defibrillation. He was then admitted to ICU on ventilation. So a person on ventilation, his ABG shows pH of 7.04, that is acidic. Partial pressure of carbon dioxide is increased. So a person on ventilatory support has developed respiratory acidosis. What is the immediate step that you need to do? So if a person develops respiratory acidosis, then we will increase the ventilation. And if a person on ventilation develops respiratory alkalosis, then we will decrease the ventilation. So this was all about acid-base abnormalities and their interpretation. I hope it's clear to everyone. If is there any question, then you people can ask. Okay, no questions.